The honourable member for Cape Breton Centre.
Thank you, Mr. Speaker. Mr. Speaker, we need to be thinking about outcomes in healthcare and not just about the convenient ones. This government likes to measure the convenient outcomes, the ones that show improvement. We're happy to see the improvement, Mr. Speaker, but we need to be truthful about where there is still much work to do. Mr. Speaker, my colleague talks about accreditation, and it's funny because when you work in the healthcare system, around accreditation time, everything is so pretty and shiny, and the healthcare workers are always above and beyond, regardless whether it's accreditation or not. But management seems to think that everything needs to be shiny during accreditation, that will make things go a lot better. Sadly, there's still a lot of work to be done, Mr. Speaker, when it comes to mental health care for kids and adults. There's still a lot of work to do when it comes to ensuring that everyone gets emergency care in a timely fashion. We have our work cut out, Mr. Speaker, for us when it comes to long-term care and recruiting more doctors and nurses. Mr. Speaker, I'll reiterate again that 20 physicians in Cape Breton have just recently resigned from their inpatient services. We spoke about a member today, Mr. Speaker, who I've emailed to the Minister of Health, the Premier, the MLA for Sydney Whitney Pier, along with the MLA for Glace Bay, who is dying to be a Cape Breton doctor. Mr. Speaker, and finally, his story is in the Cape Breton Post today, so at least now everybody is aware. Mr. Speaker, we have our work cut out for us when it comes to keeping the doctors that we have, to keeping the staff that we have, Mr. Speaker, because they are worked to death and they are run off their feet, regardless if it's accreditation or not. The government says that they're working on these issues, but we need the government to set goals, Mr. Speaker. We need to know what they're aiming for, to give us the actual specifics about what goals are being set, and we need the government to establish these outcomes. Mr. Speaker, last week we talked about statistics and numbers that are already produced. These reports are produced, Mr. Speaker, every day or every week or every month. The number of people waiting in emergency rooms, the number of patient stays, the number of people leaving without seeing a doctor. This is not costing anything more to this province, to the system, or to the government. This is just providing us with the access to know where the problems are, Mr. Speaker, so we can actually work to bring around some solutions instead of just sitting by and doing nothing. When we talk about outcomes, Mr. Speaker, we're talking so much more than just about wait times, than just about what's going on in our facilities on a day-to-day basis. Mr. Speaker, we need to have systems in place to measure whether the health care we're providing is actually working. Mr. Speaker, because I beg to differ. I say health care that we're providing is not working. Madam Speaker, we need to be getting better and staying better, and we need to know, Madam Speaker, how to do that. Wait times only measure access to care. Access is crucial, Madam Speaker, but it's only the first step. In order to get better at what we do in the healthcare system, we need to have thoughtful ways of measuring our success in place from the beginning. When we start new programs or implement new systems, we need to think about how we'll know if this new thing is working or if we should try something else, Madam Speaker. We need to be informed by something other than just the bottom line. Patient outcomes, Madam Speaker, along with everything else, determines whether or not we're doing the right thing and we're improving health care in Nova Scotia. Take nursing homes, for example. While the number of people on the wait list is only one measure of how well our system is performing, the number of bed sores any given facility reports is another. And Madam Speaker, we know that bed sores are being reported at an all-time high. We know, Madam Speaker, that because the rules have changed for admission to long-term care beds, that those numbers may have actually decreased, when, Madam Speaker, that is not actually the truth. While nursing home access across the province have struggled to prevent and treat bed sores, the St. Anne's Centre in Ayrshire hasn't had to deal with a bed sore in years because the facility takes those outcomes seriously. Residents at the St. Anne's Centre are assessed as soon as they arrive A staff member checks their skin condition, nutrition, mobility, continence, and general well-being, and determines whether or not they need a specific mattress or seat cushion. Madam Speaker, each resident also meets with a dietitian to develop a meal plan, which is customized to their particular nutrition needs to keep them healthy. What a novel idea, Madam Speaker, to actually engage with each and every resident that's coming into our nursing homes, to know exactly what they need and not just assume that 3 minutes of care every day is enough to assess their needs. Compare that to the approach this government has taken to the nursing home wait list, as I've just said. Madam Speaker, they've cut their wait list in time, but I will say that they've changed the criteria. However, hundreds of people, Madam Speaker, are still waiting in hospitals for nursing home beds and receiving home care that doesn't come close to meeting their needs. These people aren't included on the official wait time lists. Madam Speaker, we know that people are now waiting for home care. We know that the government says that they want to age in their place, but Madam Speaker, a lot of times that's not possible. And by the time these seniors actually get to long-term care, their need is much greater, and we are not meeting those needs. This is an approach to outcomes that only cares about the bottom line and not about the quality of the outcome. Madam Speaker, we need to be talking about quality and not quantity. We're talking about people's lives, and how much they should matter more than the bottom line. More, and I will say this again, more than a balanced budget. Madam Speaker, we need to set expectations high for our healthcare system. Our people deserve quality healthcare, and we can provide it because, let me tell you, Madam Speaker, we have the staff that can provide quality healthcare if we make a plan to get there and take the need to invest in it. Madam Speaker, we can't get there without significant investments and without changing the rules halfway through, because that's what we're doing, Madam Speaker, and healthcare workers are being penalized for that, and they haven't changed their outlook or their level of quality care provided to everybody in healthcare. Another place we could be doing better is measuring the general health of our population. If we measured the health of our population in a more systematic ways, we might be compelled by the data to make real investments in our social systems to improve population health outcomes. Madam Speaker, we know that the social determinants of health play a huge role in people's health. I had the privilege of meeting with a doctor from the Dartmouth General, and the doctor told me that the first thing that they put on a chart when they see a patient is social determinants of health, poverty, and then their diagnosis, whether it be asthma, flu, broken leg. Their first diagnosis, Madam Speaker, is poverty. We all need to realize how important that plays into healthcare in this province. And because we are not investing where we should, we are not spending, and I will say this, I will continue to say this, Madam Speaker, we're not spending our money wisely. We're not spending our money where we need to be spending it. We need to be spending it in healthcare, and we need to be spending it so that people can come out of poverty and actually buy some fruit and vegetables for their children rather than just Big 8 pop and cheesies. Because, Madam Speaker, that's what's happening. You can get pop a heck of a lot cheaper, Madam Speaker, than you can get milk. And when people have $2 and they have to give their child something to drink, they choose the Big 8 pop for 88 cents. And that is a disgrace. And this government, Madam Speaker, should be embarrassed about that. The research is very clear on the fact that poverty and chronic stress have huge negative impacts on our well-being. We can make upstream investments in our health care and see the outcomes. They'll show up in lower rates of type 2 diabetes, in fewer sick days taken, in wounds that heal faster, because people have the adequate nutrition. If we think about caring for people as an investment rather than a cost, then we can measure those health outcomes as well. And Mr. Speaker, I say again, it's about being proactive instead of being reactive. If we invest, as I've said numerous times, Mr. Speaker, it may cost a lot up front, but over time, we will reap the benefits of these investments. Being transparent about outcomes will build public trust. What a novel idea, Mr. Speaker. Being secretive about them undermines that trust, which is exactly what's happening right now, because in order for us to get information, we need to FOIPOP it. Keeping people from finding out what's really going on undermines that trust. Forcing private citizens to pay a fee to find out whether or not our system is meeting its own internal standards undermines trust. Mr. Speaker, imagine you have to pay to find out if this government is actually doing what it says it should be doing. The thing is, people know what's happening on the ground. They know their experience, and I spoke about that in length on Friday. And let me tell you, Mr. Speaker, people are aware of exactly what's going on. They know that it's going to be a long wait at the emergency department. They know if they call their doctor, they may not be seen for 6 weeks. Mr. Speaker, I had a constituent who was in a car accident, and the earliest she could see her family doctor was 6 weeks. It's a good thing she wasn't severely hurt, Mr. Speaker, because others don't have 6 weeks to wait. They know not to put their loved ones on a wait list for long-term care until that person has passed the point of no return. People, Mr. Speaker, know what's going on. People see what's going on, or not going on in long-term care, I should say. People see that we haven't invested in one new bed in long-term care. People see the 27 admits to the emergency rooms, and they know, Mr. Speaker, that they are there because of the lack of investment in health care. But, Mr. Speaker, we shouldn't have to assume that. We should have readily access to this information, and we need somebody to oversee it. This government should be measuring health outcomes so that everyone, Mr. Speaker, can see the true impact on the policies they are having, instead of trying to hide behind information that is not publicly available. You can't fix something if we don't know it's broken, and we should all be working together to ensure that healthcare in Nova Scotia is improving, not declining.